Sure. इधर से करना है ना मुझे। Hello, good evening, everybody. So today we are going to talk about rheumatic eye diseases. So the rheumatic diseases are the group of diseases where there's an inflammation of the connective tissue. And usually it is autoimmunological origin. Now, what are the inflammatory diseases we have? Most common is rheumatoid arthritis and spondyloarthropathies. These are the most two common diseases. And other diseases less frequent is a juvenile idiopathic arthritis, Sjogren's syndrome, systemic lupus erythematosus, and other connective tissue like scleroderma and many other diseases. Before we talk about eye diseases in rheumatic diseases, we should know the anatomy of the eye, where you can see here in the center in front in the blue color is a cornea, the ventral chamber, iris, and the lens, and behind is the vitreous, and then retina, choroid, and sclera, and the optic nerve. So in case of rheumatic eye disease, most common is a dry eye. In case of rheumatic diseases, you will see that the secretion in case of lacrimal gland, that means the aqueous secretion is reduced. And along with that, the salivary secretion is also reduced, and that is known as the Sjogren's syndrome. This is quite common. So always in chronic diseases of dry eye, we should rule out rheumatic diseases like we have to do RA factor. Second most common is a uveitis, where you will get redness of the eye, pain in the eye, and the vision is reduced. So only by a slit lamp examination, we come to know that a patient has got a uveitis. And whenever we get patients of uveitis, we have to do RA factor and many other investigations to rule out rheumatic diseases. And most common out of diseases of scleritis and episcleritis, 50% of the disease, scleritis is usually because of rheumatic disease. So in this case also, you have to rule out rheumatic disease. Here you will get localized redness of the eye on the scleral area. And here you will get pain in the eye, and while movement of the eye also there is a pain, and just swelling of the conjunctiva also. But usually it is a localized redness. So by this you will have idea whether there is a scleritis. Usually in scleritis there is pain. In episcleritis pain is not much. In case of scleritis also, if it is very severe type, you will get a scleral necrosis. You know, the scleral necrosis can lead to cephaloma, or the uveal part you will see, and it is very severe dangerous disease where loss of vision also can occur. So you have to examine whole area of the sclera if there is any degenerative or any necrosis is there. Here you will see, in case of cornea also, the ulcers are usually in the peripheral area. Why in the peripheral area? Usually because the central part of the cornea is avascular. With the peripheral part of the cornea, you will see the vessels. And through that, there is ulcerative chloritis, uh, ulcerative keratitis. And here you will see the ulcer. And usually, many cases, you will see the melting of the cornea. And you have to always examine by slit lamp examination to find out whether there is so much of a severity is there. And one more cause, in case of eye diseases, you will see the retina examination or the fundus examination by ophthalmoscopy. You will see the retinal vessels, there is a vasculitis. That means all around the vessels there is an inflammation. And this inflammation can lead to blockage of the vessels, can lead to hemorrhages and edema of the retina, and the vision is reduced. So here, whatever you see in this case of fundus examination, you should do investigation for the rheumatic eye disease. Because of all this uveitis, scleritis, episcleritis, and the corneal ulcer, for a longer time, chronic disease, you may get cataract. That is a complicated type of cataract in case of this disease. And because in case of rheumatic eye disease, the steroids are given for a longer time, also can lead to cataract. That is also a complicated cataract. You will have a subcapsular cataract. And the glaucoma is also because of uveitis and all other conditions leading to glaucoma. And one more very important is because in case of rheumatic fever or rheumatic eye disease, the HCQ is given. That also has got a side effects, maculopathy. The vision in the center part is reduced. So you have to take care and do investigations and manage the case.
So thank you, Dr. Pushpa, for sharing your ideas about the clinical aspect of rheumatic eye-related diseases. I just want to say that basically in many of these hormonal disorders and autoimmune disorders, and rheumatic eye disease very often connected to autoimmune disorders, systemic disorder where they affect the eye. And in these cases, homeopathy is known to have very beautiful results, and it's known to have beautiful results because homeopathy doesn't act only on the eye. This is the main thing. It acts on the whole person. They say you find in homeopathy you find the remedy for the person and not the disease. And many of these diseases are not only ophthalmic disease, they are actually more systemic disease, more disease which is actually connected to the entire body. And this is where homeopathy has a beautiful role. The idea to find remedy in homeopathy is to take a very in-depth case, is to find a kind of a inner pattern from different areas of one's life, trying to understand the basic state from childhood till now, the basic nature, temperament, personality, the crisis situation, how a person reacted in crisis situation, the interpersonal relationships, how they react in different interpersonal relationships, the dreams, the fears, everything. So understanding all different areas of a person, we've tried to find a remedy. In homeopathy, Master Hahnemann also beautifully says that along with homeopathy, one has to work on their kind of, you can say, maintaining cause, which in today's time has to do with one's lifestyle, one's food habits, one's sleep patterns. So understanding all of this, we find the remedy for the person. there are some very important homeopathic remedies which have action on the eye. I'm going to just tell few of the remedies that we use. However, the main remedy is generally the remedy for the person. But just for clinical knowledge, there are some very, very important remedies that one should know. And especially very deep antisyphilitic remedies are remedies which are very useful. Remedies like syphilinum, mercury, phytolacca, kali iode. Many of these antisyphilitic deeper remedies have a main action on the rheumatic eye related disorder. One of the very important remedies, calmia latifolia and spigelia. These two are very important smaller remedies that one should know typically for acute problems. So this is what I wanted to share with you. Take benefits of homeopathy, take benefits of our integrated homeopathic treatment, and whoever you can, continue kind of spreading homeopathy to people who can benefit with them. And if you wish our consultation or anyone else's consultation, you can write to us. You have our contact details. You have the email ID gaurang@gmail.com, the website detail, and the contact details. Thank you. Keep in touch.